Welcome to NP Certification Q&A, presented by Fitzgerald Health Education Associates. This podcast is for NP students studying to pass their NP certification exam. Getting to the correct test answers means breaking down the exam questions themselves. Expert Fitzgerald faculty clinicians share their knowledge and experience to help you dissect the anatomy of a test question so you can better understand how to arrive at the correct test answer. So, if you're ready, let's jump right in.
A 77-year-old male is admitted to the emergency department from a long-term care facility where he has lived for over 3 years. He has been maintained on antipsychotic medications for years, but recently required a change to a first-generation agent as his symptoms were breaking through on even high doses of olanzapine. Last evening, staff reported that he was increasingly confused, and this morning he developed a fever of 102.6 degrees Fahrenheit. Initial laboratory assessment must include A. Urinalysis, B. Complete blood count, C. Creatine kinase, or D. Complete metabolic panel. And the answer is C. C is the correct answer. This patient has classic risk factors for and clinical presentation of neuroleptic malignant syndrome, a potentially dangerous and even fatal adverse effect noted most often in patients on older antipsychotic medication. While the initial laboratory assessment may include all of the other elements, the urinalysis, the complete blood count, and the complete metabolic panel, it must include a creatine kinase because if the creatine kinase is markedly elevated, the patient is immediately treated with bromocriptine and dantrolene. So let's take a minute to dissect this question here. This is, it is a classic analysis and application question. It doesn't tell you what the diagnosis is. It gives you some information. It gives you some symptoms and it gives you a physical finding of a high temperature. You have to analyze what you think is going on, and then you have to apply that to your analysis of diagnostic study. What's the next step in the evaluation? So it's a high-level question and the kind you're likely to see on your boards. It is also very likely to show up on boards in some way or another, this concept, because this is a safety issue. Neuroleptic malignant syndrome is dangerous and potentially fatal, and you are expected to be able to recognize it. Now, having said that, you may never have seen it clinically, you may never see it clinically, but because it's a safety issue, it's very common that it will show up on your boards. I was attending my own CE event. This was a couple years ago now. It was live, so it must have been pre-COVID. But I was doing a psychopharmacology continuing education event as a student, and the speaker was talking about clozapine, I think, I forget what the general topic of conversation was, but he asked that everybody in the room under the age of 50 who had ever seen neuroleptic malignant syndrome raise their hand, and nobody did. Now, a lot of us over 50 have seen neuroleptic malignant syndrome, but nobody under the age of 50 had. So very interesting. The reason I mention that is because most of you may never have seen it, and you might never see it, but it can be very dangerous. And so you have to recognize, I remember the context. Clozapine was the first second-generation antipsychotic on the market. And one of the many reasons for the development of second-generation antipsychotics were to try to minimize adverse effects. Neuroleptic malignant syndrome is most commonly associated with first-generation antipsychotics. So any of us practicing before 1990, we were much more likely to see it clinically. So what you want to know about it, both for your own clinical practice to be safe, as well as your boards, where I'm sure you will see this concept. What you want to know about neuroleptic malignant syndrome is that the primary risk factor for it is a patient who has either recently started a first-generation antipsychotic or had their dose increased. Now, you can see it with second-generation antipsychotics, and there are other meds that can actually increase the risk of neuroleptic malignant syndrome. But the classic association, and the one you should know for your boards, is first-generation antipsychotic. And so this gentleman in this scenario has just been changed to a first-generation antipsychotic. That's an important risk factor. And then the other thing is the classic triad of clinical presentation. You may see this referred to in older books as hot, stiff, and out of it. Hot being the fever, stiff being muscle contraction, and out of it being acute confusion or acute mental status change, which this patient has. So if you encounter an older male who has recently been put on a first-generation antipsychotic and he has new onset confusion and temperature, you have to consider neuroleptic malignant syndrome as your leading differential diagnosis. And when you do, the lab that must be performed is the creatine kinase, because that's going to be your index of muscle contraction and breakdown. So if the patient has elevated creatine kinase, they're going to have to be treated immediately with bromocriptine, which is a dopamine agonist, and dantrolene, which is a muscle relaxant. And that's how you're going to try to save this patient's life. Now, if the CK isn't that elevated, very often you can treat neuroleptic malignant syndrome by stopping the first-generation antipsychotic and giving them lots of IV fluids and treating the fever. So in the conservative patient, like anybody with neuroleptic malignant syndrome, they're going to need fluids, they need to immediately stop the antipsychotic, and they need to have the fever managed. And they need to have their CK checked, because if the creatine kinase is elevated, then you've got to progress to the bromocriptine and dantrolene. That's why you have to know that. Now, this patient may very well also have a urinalysis performed, a CBC performed, and a metabolic panel performed, just to make sure that there's no other involvement. But you have to do the creatine kinase. And some of you might struggle with this because you're not that familiar with neuroleptic malignant syndrome. And you have probably been taught that any older adult that has an acute mental status change must have a UA immediately, because that's very true. If you take the antipsychotic and the neuroleptic malignant syndrome out of the picture, any older adult with acute mental status change, the leading cause is infection, and the leading cause of infection is a urinary tract infection. So, yep, a urinalysis would be indicated, except in this circumstance where you introduce the first-generation antipsychotic and that high fever, because that's a pretty high fever in a 77-year-old, then the creatine kinase must be ordered.
Thank you for listening to NP Certification Q&A, presented by Fitzgerald Health Education Associates. Please rate, review, and subscribe to this podcast. And for more NP resources, visit FHEA.com.